favorable epidemiological data and guidance from our scientific experts has led to a phased plan of gradual lifting of restrictions in 4 phases, guided by our epidemiological trends and active contact tracing. Phase 1, which started on the 4th of May, will see resumption of construction, non-urgent healthcare and schools according to renewed directives. Phase 2, which will start on the 21st of May until the June 8th, will see the reopening of some food and beverage outlets, other retail businesses with strict physical distancing and hygiene protocols in place, and mandatory wearing of surgical masks in enclosed public places for employees with strict supervision carried out. Phase 3, which will be from the 9th of June until the 13th of July, calls for reopening of large commercial places, centres, hotels and airports. Resumption of activities will be in line with directives and continued favourable epidemiological data.
Thank you, Honourable Minister. We now go to Finland. Your Excellency, you have the floor.
Honourable President, Director General, delegates. Finland aligns herself with the statement of the European Union and its member states. To complement those messages, I would like to take a forward-looking approach. When this pandemic eventually ends, the world will look different. The toll on public health, the economy, and the society are beyond anything we have predicted. Yet, I want to be optimistic. I believe we have the power to translate the commitment to global solidarity into actions and build back better. We can do this by ensuring that health workers are kept safe, the most vulnerable groups are protected, the vaccines are common goods for health, inequity is countered through social security, and businesses are supported. It is imperative that we base our actions on a right-based approach and use a gender lens. We already know what works: universal health coverage and strong health systems, health in all policies approach rooted in evidence and impact evaluation, preparedness through essential public health functions, and taking a whole of society approach. We also have new tools that will help us get there. We can boost health systems through digital solutions and technological innovation if we mind the issues related to rights, ethics, and data protection. If we resolve to take a more comprehensive approach to recovery, we can avoid the pitfalls of past recessions. The economy of well-being can lead the way to a socially, economically, and ecologically more sustainable recovery. Thank you.
Honourable delegates, I would like to take this opportunity to remind everyone that during this session, speakers are taking the floor according to the list that we have established. For remaining speakers, kindly observe the time limits for the length of statements. There are still a number of speakers left on the list for today's session. In this case, it's not necessary for delegations to raise their flag at this time. Nonetheless, we have noticed that several flags are raised, and I would therefore like to ask that flags be lowered. Thank you for your cooperation and your understanding.
Thank you, Madam President. We would now like to invite Pakistan. Your Excellency, you have the floor. We are moving on with the list, and we would like to invite Nauru to deliver a regional statement. Your Excellency, you have the floor.
Director General of the World Health Organization, Dr. Tedros, Excellencies, Honorable Ministers, Ambassadors, ladies and gentlemen. I am honored to address the 73rd World Health Assembly on behalf of the Pacific Island countries, namely Cook Islands, Fiji, Kiribati, Marshall Islands, Federated States of Micronesia, Niue, Palau, Papua New Guinea, Samoa, Solomon Islands, Tonga, Tuvalu, Vanuatu, and my own country, Nauru. We extend our warm greetings to you all from the Pacific. As of today, there are 273 confirmed cases of COVID-19 reported in the Pacific: Fiji, French Polynesia, Guam, New Caledonia, CNMI, and PNG. The rest of the Pacific are still free of the coronavirus. We have not been idle. In fact, the Pacific health ministers met more frequently than ever since early 2020. We met once a week to discuss how we can prepare and respond to COVID-19. Each of our countries has unique customs and traditions, but share many characteristics. Relatively small populations dispersed across vast distances. That mean we face many common challenges in dealing with COVID-19. Working in solidarity, we focused on a common framework of health sector preparedness and response plan for the Pacific. We inventoried the capacity of our health systems, including technical capacity on critical preparedness, readiness, and response actions for COVID-19. Critical laboratory and medical supplies, personal protective equipment, and worked with partners to address the gaps we could without any delay. It is one of the most challenging tasks we are dealing with in the Pacific, and many of us started to implement border restrictions early on to avoid importation of the virus. In my own country, Nauru, our key challenges are geographical isolation, small healthcare workforce, a small critical care units, and communal living family arrangements that can easily fuel local transmission. For the Pacific, as countries start to implement tighter border restrictions in our region and globally, it became harder to send samples for testing, harder to send critical samples in. We subsequently agreed to form a humanitarian pathway, a mechanism that enabled the provision of medical and humanitarian assistance from regional, international, and development partners in a timely, safe, effective, and equitable manner. Moving forward, our Pacific Island countries are preparing for what is going to be a new normal. We have urgent, unfinished business such as building strong health systems, closing immunization gaps we cannot ignore. And there are emerging issues that demand our attention in the new normal. The COVID-19 pandemic is a global health emergency of unprecedented scale. It poses a real and extreme danger to the health and security of the Pacific people. In this time of crisis, we gather, albeit virtually, with our Pacific family to work in solidarity and with the continued support.
Thank you, Honorable Minister. We invite now Antigua and Barbuda to deliver a regional statement. Honorable Minister, you have the floor.
Director General, Excellencies, ladies and gentlemen, it is my honor to deliver this statement on behalf of the delegations of the Organization of the Eastern Caribbean States and Barbados. The Eastern Caribbean region watched the global pandemic of COVID-19 unfold, and with great concern, particularly because of the high risk of severe disease related to our high burden of chronic and non-communicable diseases. When the first cases were imported, the region took swift and decisive action to contain the spread of the disease, relying on basic public health measures of hygiene, quarantine, detection, contact tracing, isolation, physical distancing, and travel restrictions. Allow me, Mr. President, to pause and recognize the dedication and courage of our healthcare workers who served on the front line, especially our nurses and our doctors. Containment works. All countries in the region were able to flatten the curve. However, the needed response to the public health crisis has resulted in the related unprecedented economic and social crises. International travel restrictions and strict physical distancing protocols have devastated tourism and other economic sectors. On average, tourism contributes over 50% of GDP and nearly 40% of employment across the region. Given the interconnectedness of our economies to countries in Europe and North America, our ability to respond to the pandemic is inextricably linked to the success of measures taken outside our shores. The region's response is further constrained by a fragile macroeconomic climate and high levels of external debt, contraction in donor support, and the threat of natural disasters. We are still recovering from the devastating impact of hurricanes in 2017, and the new hurricane season begins in 2 weeks. Mr. President, to ensure our small states are not left behind, the region calls on global partnership in the spirit of solidarity to address the following needs of COVID-19 and beyond. 1. Access to financing and debt forgiveness to allow the region to effectively address the fallout of the pandemic and to support vulnerable populations, households, and businesses. 2. Continued support of PAHO and WHO to strengthen health systems and support transitioning to appropriate technologies, including digital and telemedicine solutions. 3. Access to currently needed supplies for COVID-19 response and equal access to emerging rapid tests, medicines, vaccines, and technologies. And 4. Development of relevant protocols for reopening of the economies, including the hospitality and cruise industry. At this time, Mr. President, we would like to take the opportunity to thank PAHO and several regional agencies in the Caribbean community, including the Caribbean Public Health Agency, CARFA, the Caribbean Disaster Management Agency, CDIMA, the Implementation Agency for Crime and Security, IMPACT, the Regional Security System, RSS, the University of the West Indies, UWI, for their continued and invaluable support. Mr. President, I thank you.
Thank you, Honorable Minister. We would like to invite Mali. Your Excellency, you have the floor. Your Excellency, we don't hear you. Can you please unmute and start again? No, we still cannot hear you. Distinguished Minister, we will come back. We invite Togo now to take the floor, and we will work with you to resolve these issues. Your Excellency from Togo, you have the floor.
Monsieur le Directeur,
Director General, Ministers, distinguished colleagues, distinguished guests, we must cherish the memories of all of those who have lost their lives in this current COVID-19 pandemic. We hope that all of those who are currently sick will get better. Director General, the government of Togo congratulates the WHO on its leading role in organizing the response to the COVID-19 pandemic through specifically technical and financial support, but also, and most importantly, through the different guidelines that it has been publishing as its knowledge of the pandemic has increased. Similarly, I would like at this juncture to pay tribute to the other international organizations such as the African Union, as well as regional organizations, as well as fraternal countries and those countries that have given. They have supported us in different ways throughout this pandemic. Since the very beginning of the different warning signs were sent on this pandemic and the threat that it would represent for all countries, a crisis committee, which was led by the head of our state, was set up in my country. Appropriate measures were taken to protect our population and to stop the spread of the virus. These measures were trying to strike the proper balance between protecting people's health, protecting the economy, protecting people's social rights, and respecting, of course, human rights in all of their different manifestations. Thank you very much for your kind attention.
Merci, Monsieur le Ministre.
Thank you very much, Minister.
We are going back to Mali. Distinguished Minister, you have the floor.
je ne sais pas qui avait gardé son appareil, non? Hein? C'est la technique. C'est chez eux?
It seems we still have technical problems with Mali. I will now like to invite Haiti. Honorable Minister, you have the floor.
Prendre la parole au nom de la
I'm taking the floor on behalf of my government. Madam President, Director General of the WHO, Excellencies, ladies and gentlemen, allow me to send to you the warm greetings of the President of Haiti. Haiti aligns itself with the declaration that has been made by Djibouti on behalf of the French-speaking group. Madam President, like most countries, Haiti has adopted a number of measures to prevent the spread of this pandemic. And before the illness reached our country, our authorities had developed, according to the WHO's directives, a response plan. On the 19th of March, following the emergence of the first case, they decided to decree a state of emergency throughout our national territory. Similarly, a scientific body was set up, as well as a multi-sectoral management commission. A number of measures were set up, and some restricting measures were strengthened, and additional resources were mobilized to implement the plan. To date, we have, however, we must recognize that there are, of course, a number of weaknesses in our health system, and therefore the country has not been able to face the numerous challenges presented to it by the pandemic. International solidarity and cooperation are more necessary now than ever. Madam President, this COVID-19 pandemic has underscored the need to have strong health systems which are resilient and which are linked on based on international solidarity, and which are directed at world health and universal health coverage. In this regard, Haiti fully supports the international platform which would accelerate the development of and distribution equitably of tests, vaccines, and treatments, as well as the strengthening of the health systems for the most vulnerable. My delegation would once again like to make a plea in favor of including Taiwan in the discussions of the WHO. It should not just be an observer. Today, we have to ensure that we can strengthen our world health system. The interpreter apologizes, the speaker is not audible.
Haïti est convaincu que par la commun de nos et de nos connaissances, nous arriverons à surmonter cette crise sanitaire mondiale sans précédent. Merci de votre attention.
Thank you very much for your kind attention.
Merci, Monsieur le Ministre. I would like to invite Maldives. Your Excellency, you have the floor.
Director General, my fellow Ministers of Health and other representatives from member countries, Chairperson, Assalamu alaikum and warm greetings from Maldives. At the very outset, I wish to state that in this time of an unprecedented global public health crisis caused by the COVID-19 pandemic, peoples and nations, and above all, we Ministers of Health need to stay ever more focused, resolute, and lead the efforts to overcome this calamity. For countries as well as for WHO, This crisis has taught many lessons that no country or the world could predict a crisis of this nature or magnitude, that the less obvious consequences or collateral can be as impactful. As countries exhaust all their resources and energy on COVID-19, there may be other neglected health issues and health system needs, as well as socio-economic fallout from this crisis. Therefore, in my opinion, we need to look beyond and the aftermath of the pandemic. Another important conclusion we can draw from this crisis is the importance of health in all spheres of life, be it economy, be it environment, or any other aspect of life. The primacy of health cannot be undermined. When the world is faced with global health crisis, it is all of humanity that suffers. Mr. Chair, just like other countries, and despite early and rigorous efforts, Maldives was unable to prevent it from our shores and had to face its consequences. On one hand, the freeze on tourism activities and fishery exports were affecting our very livelihoods, while on the other, manufacturing countries were placing embargoes and global movements of goods came to a grinding halt. This affected us badly, impacting our containment efforts as well. Medical and other supplies were becoming very hard to procure and import. Here I wish to laud and appreciate the regional leadership by WHO Regional Office and bilateral assistance from neighboring countries, particularly that of India. And although not from our region, we also wish to note the assistance from China. Maldives, China has enjoyed decades of cooperation based on our commitment to One China policy. Indeed, we can contain this pandemic only through regional and international cooperation, and when all countries start working together and sharing critical information and resources. Viruses do not recognize borders. Together as one world, we can overcome COVID-19. Thank you.
Thank you, Honorable Minister. I would like to invite Brunei Darussalam. Your Excellency, you have the floor.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi ta'ala wabarakatuh. Mr. President, Vice President, Honorable Ministers, Director General, ladies and gentlemen. On behalf of the government of Brunei Darussalam, I wish to extend our sympathies to all who have lost loved ones and express our solidarity with those affected by COVID-19 and the healthcare workers and frontliners who work tirelessly to combat this. Since the start of the outbreak, we have detected a total of 141 cases and reported 1 death. Thankfully, through a careful program of testing, contact tracing, isolation and treatment, we have managed to control our first few clusters. Although the battle is not yet over, I wish to share 2 lessons from our experience in responding to COVID-19. First is the importance of enhanced surveillance and testing. We are an early adopter of testing in absence of symptoms, and we also conduct random sampling in community health centers and among the foreign worker population. Our test per capita ratio is among the world's highest, and we believe that containment efforts have been crucial in preventing widespread community transmission. Second, we established an effective community engagement strategy with daily press conferences, a dedicated 24-hour hotline for public inquiries, and a self-screening mobile application integrated with artificial intelligence and data analytic capabilities. Civic society has played a key role, and a significant grassroots movement sparked a surge of volunteerism and community advocacy. Our emphasis on containment along with community engagement has allowed us to control the disease without resorting to whole-scale lockdowns. Although we have implemented some level of moderate physical distancing, public services and businesses remain open and no movement restriction within the country have been imposed. As such, this combination of targeted approaches can be a useful way forward in the months ahead. Adopting a phased approach to de-escalation and leveraging technology for swift contact tracing could be a viable strategy to sustain the response to COVID-19 pandemic. We stand ready to work with WHO and the global health community on this important issue. Thank you.
Thank you, Honorable Minister. We would now like to invite Paraguay. Your Excellency, you have the floor.
Señor Presidente.
Distinguished President of the WHA, Member States, WHO Director General, this year's Assembly is taking place in an extraordinary context, and Everybody needs to pull together to face up to this pandemic, which means that we need to rethink our healthcare systems and rethink the reintegration of our peoples. We in Paraguay have taken drastic decisions very early in order to combat the pandemic. We recently experienced a dengue epidemic, and therefore the healthcare system was extremely fragile anyway and involved in a reform process. But we focus on the value of life. And current figures show that the decisions that we've taken have been the right ones. But the situation is extremely difficult. We need to emerge from lockdown gradually, and we need to use intelligent, smart quarantine. We need to ensure that we don't make mistakes at this crucial time. The people of Paraguay has supported the government in this approach and is promoting a new series of lifestyles. And what's absolutely vital is that all stakeholders are involved. We need to include prevention as well as efforts to combat the pandemic at borders. We need to ensure the full participation of Taiwan in the World Health Organization. A status observer would enable them to come here to the Assembly and share their experiences with the world. So we need to fight this pandemic together. We need to do our utmost to support the health of our peoples. We know that humanity needs to find fairer and more effective ways of living together and growing together. Thank you very much indeed.
Thank you, Minister. We would now like to invite Pakistan. Your Excellency, you have the floor. We will continue with Ethiopia. Honorable Minister, you have the floor.
Thank you, Chair. Ethiopia commends the Director General for his inclusive report on COVID-19 and highly appreciates the fundamental leadership role of WHO in coordinating the comprehensive global response to the COVID-19 pandemic, as well as supporting the national response efforts of member states. The dedication of WHO leadership and staff demonstrated is to be highly valued rather than undermined during this crucial moment. Excellencies, distinguished delegates, the increased adverse impacts of COVID-19 pandemics on the lives of people and in the fabrics of society around the world is concerning. The virus is not only attacking the health of our people, but also devastating economies, social and cultural lives, and affecting our way of living at large. This is why the COVID-19 response requires a whole of government, a whole of society approach at national level and increased collaboration and support with a spirit of solidarity at the global level. Ethiopia calls for universal, timely and equitable access to quality, essential, affordable and efficacious health technologies and products, including vaccines, diagnostics, therapeutics and protective equipment. We call for the removal of all kinds of legal, policy, or technical barriers that impede access. Since the first case was identified in Ethiopia on March 13, 2020, the government of Ethiopia took decisive measures, multidimensional measures to contain the spread of the disease in the country. Ethiopia is also actively contributing to the continental response through ensuring timely distribution of test kits and protective equipment to the African countries in collaboration with WHO, Africa CDC, and our partners. Ethiopia is committed to continue working closely with our neighboring countries to control the spread of this devastating disease in the region. I would like to conclude by reiterating that the only way out of this unfortunate and dreadful situation is collaboration based on respect and solidarity. I would also like to emphasize the instrumentality of WHO's leadership in order to overcome the challenge and to recover quickly by adopting to the new norm of global health security and health diplomacy. Thank you.
Merci, Madame la Ministre.
Thank you very much, Madam Minister. You have the floor, Your Excellency. Gabon.
Madame la Présidente, la délégation.
Thank you very much, Madam President. Our delegation congratulates you on your election to the head of the 73rd WHA and welcomes this World Health Assembly in its virtual form during this horrible pandemic period. Madam President, Gabon has, on the 12th of March 2020, had its first case of coronavirus. The head of the state instructed the Prime Minister and the government to work together to come up with a response to COVID-19. Hence, a steering committee for a response to the coronavirus was set up, and there were 2 technical commissions which were set up to lead the different interventions throughout the country. They were working with the scientific committee, which was also set up. They were ensuring the basic health services would continue to function during phase 4 of the epidemic. Gabon adopted a number of measures, both health measures, security, social, economic, and other measures in order to mitigate the impacts at a local level. With regard to health measures, the focus was on mass testing as well as taking care of those who fell ill with COVID-19, as well as active research of contacts of those who were infected and confinement of those who were at risk. And of course, last but not least, protecting health personnel and taking protective measures. Madam President, COVID-19 is not just a health crisis, it's a socio and economic crisis. That will require us to think of the supply chain, have a paradigm shift in our economic model, and rethink international cooperation. Coronavirus will show us the way forward. We have to rethink how we manage our resources. This gives us an opportunity to plead for preventative measures to be taken against COVID-19 and that people universally share any measures taken. There is, of course, a need to find a remedy to this disease, specifically for developing countries in Africa, because it is an issue of health security and something that can affect all of humanity. Lastly, Gabon welcomes the work of all partners who are committed to come up with a response to COVID-19. And we salute the work of the Director General of the WHO. Thank you very much for your kind attention.
Merci, Monsieur le Ministre.
Thank you very much, Minister.
Invite Belarus. Your Excellency, you have the floor.
Господин председатель.
President, the coronavirus pandemic is a serious threat to world health, and its fallout, political, economic, and social, is something that impacts everyone. That's undoubtedly the case. The pandemic is not yet over, and yet we're already discussing lessons learned. We'd like to draw attention to 3 of them. The first is that the pandemic has demonstrated that there is no unity and solidarity throughout the world, which would have allowed us to come up with a quick response to this crisis. And this is a fitting result to the current geopolitical uncertainties that exist. The president of Belarus, Alexander Lukashenko, proposed a way out, which would be a global dialogue on security. And this would lead to more constructive international relations. This would allow us to come up with an effective response together to deal with transnational threats. The second point is that the pandemic has demonstrated a need to have an effective global governing body, which is, of course, here the WHO. We are convinced of the need for further strengthening of the WHO and its response mechanisms to allow it to respond to world health challenges. Thirdly, the national context is an important factor in developing a key response to the crisis. We're convinced that Belarus has taken the correct course of action, and we were able to keep the government up and running, including keep the economy in good shape while ensuring the maximum protection for our people. We were providing needed medical care under very difficult conditions, and we prevented the uncontrollable spread of the virus thanks to maintaining efficient health and epidemiological control measures, which have worked to be an important factor to stop the spread of the virus. We've been able to find and locate outbreaks and temporarily isolate those contacts of people who were possible infection spreaders through widespread epidemiological investigations. And that work was done before we even had the first case. This has allowed us to maintain the level of medical supplies and medical care even under the pandemic. We do not have a total lockdown in our country. However, all of the scientific and proven measures that were recommended by the WHO have been used in our country. We have been able to reach one of the lowest levels of fatality, less than 1% in our country. And a number of countries who are now exiting the quarantine period are beginning to follow the course of action that was originally suggested by Belarus. Allow me to express the hope that today's irregular session of the WHA will lead to a paradigm shift in fighting the pandemic. I thank you very much for your kind attention.
Sure.
Thank you, sir.
I would like to invite Angola. Your Excellency, you have the floor.
Excellency, Madam
Your Excellency, President of the WHA.
Delegate, this year we are in a different way in a very complex sanitary and economic context that requires our countries individually and collectively to find innovative and pragmatic strategies to respond to the challenge never experienced in the recent history of humanity. Excellency, Angola, like the other countries, is in a demographic, epidemiological, and economic transition, with the health having several challenges in parallel high level of with the Republic of China. The country started in February this year implementation of strict prevention and preparedness against COVID-19. As soon as it became aware the occurrence of major events in that country, the executive, under the high direction of our President, João Lourenço, adopted the National Multisectorial Plan with specific financial resources allocated by the Ministry of Finance of Angola. Initially, the measure consisted of closing borders, banning commercial and private passenger flights from Angola abroad and vice versa, institution of mandatory quarantine with surveillance of passengers and flights, transport of support for healthcare and stating immunological surveillance to suspected cases and their contacts. Also, the subsequent measures consist of: number one, declaration of emergency and the publication of decrees. Number two, establishment of interministerial commission coordinated by the presidential office as well as other protective decrees. We approved with specific measures aimed to delaying the introduction and transmission of virus, the spread of pandemic throughout the country, protecting the most vulnerable population and the function of the economy. Mrs. President, the early implementation of these measures, in addition to home confinement, social distancing, hand hygiene, wearing masks, and extensive information campaigns on the epidemic of others has allowed the situation to be controlled. Today, we are with 50 cases. So far, confirmed 3 deaths, 30 admitted, and 14 recovered patients. The National Institute of Health Research has already proceeded 5,978 tests, but we are very about the community transmission phase because massive testing a challenge. The big challenge is in Angola, the wide screen of population group of at risk for the characterization of community circulation of the virus. We therefore take the opportunity to ask for support of WHO in this area, as well as the strengthening of mechanisms to improve cross-border health surveillance within the framework of international health regulation. I seized the opportunity to express Angola's to the draft resolution of COVID-19 response submitted at the WHA73, as well as to associate ours with statement delivered by the African group and the non-aligned movement, and concur as well with deliberation proposed by the WHO.
Excuse me, Madam Delegate, I must interrupt. I was trying to be very understanding and lenient with you, but you have unfortunately far exceeded the time limit. I must implore speakers to adhere to the time limit. 2 minutes for national statements and 4 minutes for group statements. I do apologize.
Thank you. Thank you very much for that.
Thank you, Madam Minister, and thank you, Madam President. We would like to invite Albania. Your Excellency, you have the floor. We would like to invite Slovenia. Your Excellency, you have the floor.
Distinguished President, Director General, dear delegates, Slovenia would like to align itself with the statement of the EU and its member states. Response to the COVID-19 pandemic has demonstrated that Slovenia has a strong public health system with well-coordinated primary health care and public health program for emergency preparedness and response. Efficiently organized civil protection with strong and dedicated health workforce, including laboratories, helped mitigate the health impacts of the pandemic. WHO external evaluation of the international health regulations core capacities performed in Slovenia in 2017 contributed to improve national emergency preparedness and multi-sectoral approach. Consequently, we perceive such evaluations as an important contribution to the implementation of the international health regulations. We have all experienced many uncertainties in responding to COVID-19. Slovenia appreciates the efforts of WHO in coordinating global response and is stressing the need for an appropriate evaluation that will contribute to better preparedness in the future. It has become evident that ensuring adequate and equitable access of essential medicines, medical equipment, personal protection equipment, and supplies is crucial. Transparent and inclusive international policies toward the development, manufacturing, and distribution of vaccines and medicines are needed for efficiently responding to the pandemic such as COVID-19. Providing access to new affordable vaccines, medicinal products, diagnostics and treatments in the spirit of global solidarity for all is necessary for our common success. To conclude, COVID-19 pandemic is a huge test for our health systems and societies. We strongly believe that cooperation and concrete action is accelerating implementation of already agreed international commitments is vital for ensuring preparedness and appropriate response in safeguarding health of our populations now and in the future. Thank you.
Honourable delegates, we have been at it for quite a while now. I think it would be good for us to take a short break. I suggest 10 minutes. I will ask the Secretariat to give an indication of who will be the speakers upon our return.
Thank you, Madam President. We will start with Turkmenistan, Slovakia, Austria, Mali, Timor-Leste, Egypt, Sierra Leone, and then we will continue. Thank you.
10 minutes, please. We'll now continue to hear the statements by delegations, which are provided under item 3. And I will turn the floor over to the Secretariat to manage this session.
Thank you, Madam President. As announced before the break, we would like to invite Italy to take the floor. Honourable Minister, you have the floor.
Madam Chair, Honourable Ministers, distinguished delegates, Italy aligns itself to the statement of Croatia on behalf of the European Union and its member states. Firstly, I would like to express our appreciation for the decision to convene this session of the World Health Assembly, and I want to thank WHO for the support of these months. In this period, we have all taken measures to stop the COVID-19 pandemic, and we must be ready to account promptly for our choices to our citizens and their representatives. We believe that it is absolutely necessary to start immediately, also within WHO, joint reflection on an emergency that is affecting the whole of humankind, and to develop a broader assessment of this experience. A first consideration is certainly the central role taken on by health at this time of history. It is a role that must be maintained and enforced in the future to ensure that we are prepared for the challenge to the health, security and social and economic stability of our communities. Consequently, the national ministries and the international bodies in charge of this issue will also need to enter a new season and be revitalized by extensive reforms. In particular, as regards WHO, we must ensure that it maintains abstractions its central role, especially in times of crisis. This means that from this point forward, we need to work together to build an always stronger agency, rethinking its role and operation. At the same time, we must ensure that it is fully independent of any external influence, whether political or financial, that is only guided by science, and that is transparent in its process and fast in responding to challenges that can be complex, such as the pandemic. We should all commit to supporting this process from today, allocating appropriate human and financial resources to it, with the objective of raising the global preparedness and response capacity of individual states, with the support of the agency high-level technical and scientific expertise and solid organization at the service of all people. A fundamental challenge is the development of a safe and effective COVID vaccine. We have to fight to consider it a global public good, a right of everyone and not a privilege of few. Thank you very much.
Thank you, Intali. We would now go back to the two regional group statements that we had technical problems with in the previous session, and we would like to call Djibouti. Monsieur le Ministre, vous avez la parole.
Monsieur le Directeur Général.
Thank you. Director General, it is my honor to make this statement on behalf of the French-speaking countries group, which has observer status at WHO. To begin with, we'd like to express our deepest condolences to families and individuals people who've lost their lives as a result of the pandemic. We'd also like to express our gratitude to healthcare professionals and other frontline workers who have been demonstrating extraordinary courage and dedication in doing their jobs to help to contain the pandemic and ensure the provision of essential health services, which are a sine qua non for the smooth operation of our societies. We welcome WHO's playing a leading role in coordinating the global response to the COVID-19 outbreak. And at the same time, we welcome the efforts which have been made by the United Nations and its partners and other actions undertaken with this end in mind at regional and at sub-regional level. We are particularly grateful for what has been done to protect the most vulnerable people in our societies. Our group welcomes the initiatives which have been taken by the International French-Speaking Countries Organization to support its member states and their people in the ongoing fight against coronavirus, particularly in the areas of education, digital technology, cultural, economic and social activities. We are convinced that we can only effectively tackle and beat this pandemic through a collective solidarity-based multilateral action founded on human rights and with a particular focus on the rights of women, whose role is absolutely essential. That's particularly the case in a time of major global crisis. We fully support the international cooperation platform to speed up development of and ensure the fair distribution of testing kits and potential vaccine, particularly for the most vulnerable countries and societies. This was recently launched and is coordinated by WHO, and is not the only initiative it's coordinating, of course, at international level. Last but not least, we encourage WHO to step up its efforts in order to ensure the quickest and smoothest possible access to the strategic documents produced by the organization in all UN official languages, and in the specific context of the COVID-19 pandemic, rapid access in those same official languages to the guidelines, protocols, advice and training courses produced by the organization. I wish you and all of us a successful virtual World Health Assembly. Thank you.
Merci, Votre Excellence. Now we proceed with the Netherlands, followed by Myanmar. Netherlands, Your Excellency, you have the floor.
Dear colleagues, It's an honor to address you as the chair of the steering group of the Global Health Security Agenda, the GHSA. The GHSA represents over 70 member states, important international organizations, and non-governmental and private sector members. Our common aim is as simple as it is difficult. We want to improve the worldwide implementation of the WHO international health regulations. And that's easy said, but we all know it's not easy getting it done. But what we know is this: it's a crucial global tool when it comes to preparing ourselves against outbreaks of infectious diseases such as COVID-19. The situation we all find ourselves in today, with lockdowns, overflowing ICUs, and our economy suffering, proves that an effective implementation of the international health regulations is more important than ever. The members of the GHSA work from the principle that solidarity and cooperation are key. And we do this from a One Health perspective, as human, animal and environmental health are complexly linked, as the current zoonotic pandemic so clearly illustrates. It's our common aim to bolster pandemic preparedness and response capacities in countries by spurring political commitments and actions, by engaging the range of sectors with equities in health security, and by drawing on expertise from across our diverse membership. We share knowledge and good practices widely. While all of us know that the best way to deal with this crisis is to stay at home, we also know that the road out of this mess is the road on which we walk together. For this, the GHSA calls on everybody to commit to specific, focused and concrete actions now, so the world will be better prepared to brave the next outbreak in the future. I thank you.
Thank you for that group statement, and we now continue with the national statements. Myanmar to be followed by Algeria. Myanmar, Your Excellency, you have the floor.
Hear me?
Yes, we do. Please go ahead.
Thank you, Mr. President. I'm delivering a statement on behalf of the Minister of Health and Support of Myanmar. Honorable President, Excellency, Mr. Director General, this is the time when all health ministers are busy tackling the COVID-19. Myanmar is fighting this torch after adapting some of the global strategies and interventions to suit our country's scenario, given the fact that Myanmar is a developing country but with a relatively strong health system. From the very beginning, starting 5th January 2020, we have issued guidelines, standard operating procedures, do's and don'ts to prevent and control COVID-19. We take note of the fact that the virus is new. We are not fully aware of the behavior of the virus. So that's the natural history of COVID-19. We therefore need very clear-cut scientific evidences from WHO and other renowned research and health institutions like CDC Atlanta and WHO collaborating centers in the real-time basis. Sharing of experiences among neighboring countries is one of the predicators for successfully controlling and containing the pandemic. We should give special attention on the importance of psychological impact of COVID-19 on the population, let along the economic impact. At the same time, we should take advantage of conducting several relevant researches for helping us in managing and containing future pandemic. Myanmar's experience is that as the pandemic is progressing, it is clear that without proactive involvement and synchronized collaboration and coordination of the population, we will not be successful in containing the pandemic. Under the able leadership of our State Councillor, Aung San Suu Kyi, Chair of the Central Committee on Prevention, Control and Treatment of COVID-19, I should say we can keep the situation under control at this point in time. In managing this pandemic of such magnitude, we should be swift in action as the interventions are time sensitive or time bound. Before concluding, Madam President, my delegation would like to reiterate our support of the One China policy in line with the UNGA Resolution 2758. We are of the view that any arrangement allowing Taiwan's participation in WHA should be guided by the One China policy. I thank you, Madam President.
Thank you very much, Your Excellency. We will now go to Algeria. Votre Excellence, vous avez la parole.
Your Excellency, you have the floor. Madam Chair, Director General, honourable participants, Algeria would first of all like to express its deepest condolences to the families and friends of the victims of the COVID-19 pandemic, and we'd like to pay a strong homage to all of the first-line workers in the fight against this illness. This pandemic reminds us of the importance of our assembly, and it shows the importance of multilateralism and solidarity and international cooperation. Since the virus appeared, multi-sectoral measures of a wide range have been undertaken by our state. They are based mainly on prevention, communication, lockdown of the areas of infection, and adoption of a national treatment protocol, as well as standardization of diagnoses. And that is important, and we have the honor to be committed within the continent of Africa with our fellow countries in strengthening the response capacities on a regional level under the aegis of the African Union and in collaboration with the WHO's Regional Office for Africa. On this, Algeria welcomes the role of the United Nations system and the leadership of the WHO in aiming to provide a global response to COVID-19 in order to provide a global response to the virus. We also welcome the resolution on the response to COVID-19, and we fully align with it. And we hope that it will serve as a roadmap for the international community when a safe and efficient vaccine is found. It seemed to us essential that reference be made to the universal access to products and technologies which are necessary to fight against COVID-19, as well as their fair allocation and their availability at affordable prices. These are essential conditions that need to be brought together if we want to efficiently eradicate this pandemic. I could not conclude without calling on the international community for a joint global action to mitigate the economic, social and humanitarian impact of the pandemic, particularly in developing countries and those with the most vulnerable financial situations. So we are all called on to draw lessons from this pandemic in order to avoid such a catastrophe being reproduced, and the WHO will play a central role in that. And Algeria will continue to work for this end, as well as carrying out the health for all of the SDGs. Thank you. Thank you, Your Excellency.
Russian Federation. Уважаемый министр, вам слово.
Your Excellency, Minister, the floor is yours. Thank you very much, Director General. Chairman, ladies and gentlemen, we thank the Director General for his report, and we fully support the efforts of WHO to fight the novel coronavirus pandemic. The Russian Federation has taken a comprehensive set of measures which have prevented the exponential growth of COVID-19 across the country. In order to do this, we took a wide-ranging set of measures, including preventing people from going to work for 1.5 months. Furthermore, we have carried out wide-ranging testing of the population every day. 150,000 tests are carried out, and the number is increasing. We've also had a wide-ranging public information campaign. In order to provide the necessary medical help, we have provided retraining to over 1.4 million medical specialists, and we have added 130,000 specialized beds to our hospitals, including in intensive or critical care. We have also provided PPE to our staff, although I admit we had problems with that at the beginning. These measures have led us to have one of the lowest fatality rates in the world. We are also producing testing kits in Russia. There are over 20 different types at the moment. Furthermore, we're developing drugs to treat people throughout all stages of the disease, and those are already being used. We're working very hard on developing a vaccine, and we hope to start clinical trials within a month or so. We also have a national plan to ease our lockdown measures in place. The Russian Federation supports strengthening WHO's role as the international coordinating center for global public health measures. We also support it coordinating multilateral efforts to fight COVID-19. We have provided financial and other resources to WHO to help it play that role and supported the organization's work and its initiatives. Russian experts have participated in WHO country missions to fight the outbreak of coronavirus. Last but not least, we would like to underscore that only through our joint efforts will we be able to conquer this pandemic. Thank you for your attention.
La République démocratique populaire Laos.
Thank you. Lao People's Democratic Republic, please. You have the floor.
Pandemic has adopted the traditional ways of living, traveling, and working, and it will stay with us for some time, if not forever. Global challenges need a global response. Do you hear me? Hello?
Yes, we can hear you. Please go ahead, Your Excellency.
Hello?
Yes, we can hear you. You can proceed, please.
Okay. Excellencies, the COVID-19 pandemic has disrupted the traditional ways of living, traveling, and working, and its global challenges need a global response. We acknowledge and thank Dr. Tedros for his key role for bringing a global solidarity to address this crisis. Low and middle income countries are the most vulnerable and need special attention and assistance. At this time, the WHO needs support more than ever to effectively carry out its critical duties on global coordination and assistance around the world. Madam President, my country is very limited resources and capacity to deal with a large number of infected people. We therefore took early preventive measures to contain infection as much as possible. We profoundly thank the valuable assistance from the friendly countries and international organizations who help us to limit the number of infected cases to 19 with no deaths. We have taken this precious time with a few cases to strengthen our hospital capacity, including infection prevention and control, and to build committee mechanisms to detect cases early. I also firmly hope that the assistance will be continued so that we can meet the SDGs and no one will be left behind. In closing, I wish more solidarity and collaboration to overcome this difficult situation and better maintain essential health services. We confirm our full support and cooperation for the success of the meeting. I do thank you.
Thank you, Your Excellency. I would now like to invite Bahrain to take the floor. Distinguished Minister, you have the floor.
بالنيابة عن وزيرة الصحة معالي الرئيس.
Your Excellencies, I am speaking on behalf of the Minister of Health, Director General of the WHO, Your Excellencies, ladies and gentlemen. First of all, I have the pleasure of welcoming the efforts that have been made on a global level, as well as the solidarity we've seen to confront the COVID-19 pandemic. This has had a negative impact on many sectors and has placed an unprecedented burden on healthcare services as well as social and economic services throughout the world. We meet today at the 73rd World Health Assembly, and we had planned to meet together and to celebrate the International Year of Nursing and Midwifery Staff. But unfortunately, we were unable to hold these events as we had planned to meet this goal of consecrating this year to these healthcare workers, and we would like to express once more all our thanks to them. So today we are here to consider the frontline healthcare staff, doctors, nurses, and all healthcare staff who have mobilized to face the challenge of this virus. Many lives have been lost because of this virus, and the medical staff have been challenged more than ever before, and their lives have been in danger. At this time, life is difficult for everyone, so we need to mobilize throughout the world to try and limit the propagation of this virus and take every necessary measure to face up to this pandemic and to rapidly find efficient treatments. The WHO should play a significant role on this in service to all of humanity. Your Excellencies, in the Kingdom of Bahrain, we have undertaken a government approach which is integrated so that we can face the challenge of COVID-19. This has an important
role in limiting the spread of the pandemic, and we have highlighted a united and efficient strategy under the guidance of Prince Salman bin Hamad Al Khalifa, the Prince and Vice Commander of the Forces of Bahrain and Vice Prime Minister. He has set up a team of healthcare staff and doctors and all government bodies in order to take preventive measures and to adopt all the policies necessary for the lockdown, for mobilization and public awareness raising. Within the Kingdom of Bahrain, we have provided the necessary finance for the expansion of hospital capacity and for areas of quarantine. We have drawn up a plan for the provision of the necessary stocks for laboratory tests and the provision of personal protective equipment. We have provided the necessary training to ensure that our healthcare staff were qualified. In terms of the management of treatment capacities, we've adopted protocols which have proven to be efficient within the kingdom. And we have seen the recovery of many people who were affected. We've also participated in clinical trials, Solidarity, and we've seen the results in particular in terms of the use of plasma of those who have recovered from the disease. As Dr. Tedros said, no one will be safe until we are all protected, and therefore we must continue to use every effort with the WHO to overcome this epidemic and to ensure that we cover everything. Thank you very much.
Thank you, Your Excellency. I would like to invite
Thank you, Your Excellency.
Kyrgyzstan. Your Excellency, you have the floor.
Thank you very much. I'd like to convey my greetings to all the participants in the 73rd World Health Assembly and express our gratitude to the Director General of the organization, Dr. Tedros Ghebreyesus, for having organized this virtual World Health Assembly. The COVID-19 outbreak, which was declared by WHO to be a pandemic on the 11th of March this year, is a very serious threat to every country in the world and their peoples, and it has meant that our way of life has been turned upside down. In order to prevent outbreaks and further spread of the coronavirus infection, the Kyrgyz Republic, in accordance with WHO's recommendations, has been actively working on tracking, tracing and isolating those people who have been in contact with infected people and to treat those who fall ill with COVID-19. The pandemic and its social and economic consequences may well reduce the likelihood that we will achieve the Sustainable Development Goals at the time we were set to achieve them. The government of the Kyrgyz Republic has been taking a series of measures to mitigate the negative impact of this pandemic on its economy. We believe it essential that in current pandemic conditions, we all join together and put our shoulders to the wheel in order to take coordinated, urgent measures to control and end the pandemic, and at the same time to exchange our experience and information. We can spare no effort, whether that be scientific, technological or medical, to fight what is a global problem. We are certain that with our joint efforts, using new instruments and taking note of the vital lessons we can learn from this pandemic, we will be able to appropriate health treatment and cure to our peoples. Thank you very much for your attention.
Excellency, we now call Azerbaijan. Distinguished Minister, you have the floor.
Thank you, President. Distinguished Director General, ladies and gentlemen. At what is a very important assembly session, which is being held virtually for the very first time in the organization's history, our main, if not only priority, must be to fight the COVID-19 pandemic. It is difficult to underestimate the vast amount of work that has been done to help control and reduce the effect of the pandemic by the organization and by its member states in such a short time, and also to mitigate its consequences. However, in many cases, countries have been left alone to fight this evil, and I think we all need to understand that the problems are the same in Africa, Asia, Europe, the Americas, and individual countries' problems are not just their problems, they're problems for all of us. The president of Azerbaijan made this clear in an appeal to our people. He said, "Together we're stronger," and that puts it in a nutshell. Only if we work together and implement the strategy WHO has outlined, we will be able to vanquish this pandemic. As for our country, I'd like to say that our government has taken appropriate measures to fight the pandemic, measures of several different kinds. We have taken them in order to prevent the virus getting into the country where it has. We have worked and taken measures to avoid the disease's spread throughout the country. We have been tracking, tracing and identifying infected individuals, and we've been providing appropriate medical care. As a result of all that, at the moment, we have only 3,274 patients in a country with a population of 6 million. The mortality rate has been 1.2%. Fighting this global pandemic is something that can only be done through solidarity and cooperation between countries and international organizations, especially WHO. That cooperation with international organizations and among the international community is now more important than it's ever been. We think that delegations working with the WHO have made clear today that only through joint work to tackle this pandemic we will be able to overcome it. In conclusion, let me say that strengthening and consolidating our joint efforts will be to everybody's benefit, and that will be a major achievement, perhaps the major achievement of global civilization. Thank you.
We would like to invite the Arab Republic of Syria. Distinguished Minister, you have the floor.
Thank you, Madam Chair. This session of the World Health Assembly is taking place today because COVID-19 has prevented us from meeting traditionally. And we'd like to talk about the essential principles of the United Nations, those of solidarity, international cooperation in the face of global challenges. We must avoid politicizing the work of this organization, in particular at a time when the world is suffering from a pandemic which will have a medium and long-term effects. In Syria, our health workforce are bravely facing up to the pandemic and the circumstances which are the consequences of the social and economic war which is waged against our country and has been for 9 years. The economic sanctions, which are coercive and unfair, have been impeding the capacities of many essential services, in particular healthcare services. Today, when countries which have solid healthcare services are struggling to fight this pandemic and save the lives of their citizens, we can see the United States of America and European countries persisting with the coercive measures against Syria and continuing their inhuman blockade, which damages our capacity to respond as a healthcare system and preventing the healthcare system from having access to preventive, diagnostic and treatment products. So we call once more on the removal of these measures so that we can ensure the health safety of our citizens, whatever their situation. Ladies and gentlemen, this healthcare situation in Palestine and in particular those detained in prisons in occupied territories are extremely serious, and we'd like to condemn the brutal measures to which they are subjected today. We call on the United Nations and other agencies to call against this, and we'd like to also mention the principle of a single China. Thank you.
Thank you, Your Excellency. We would like to give the floor to Nauru. Distinguished Minister, you have the floor. We have small technical problems. We will come back to Nauru later. I would now like to invite Uganda. Distinguished Minister, you have the floor. We will proceed to Mozambique now. Votre Excellence, vous avez la parole.
Excellency, you have the floor.
On behalf of His Excellency Minister of Health of Mozambique, Dr. Tiago, Madam President, Honorable Ministers of Health, Director General of WHO, distinguished delegates, Mozambique aligns itself with statement presented by Congo on behalf of the African Group. It is with great honor that I address this assembly, and I would like to start by congratulating the Director General of WHO and his team for the leadership and technical support provided to prevent and combat this pandemic. Allow me to convey the message of encouragement from His Excellency Filipe Jacinto Nunes, President of the Republic of Mozambique, and the government for the efforts made by the United Nations agencies, in particular the WHO, in responding to COVID-19. It is with that value of this support that Mozambique still registers a relatively small number of COVID-19 cases. We are convinced that if we continue to work with all stakeholders, including communities, we can break the chain of the infection transmission. Until today, Mozambique registers 145 cases of COVID-19 with no deaths, and is following all the protocols from WHO regarding prevention, health promotion, diagnosis, and treatment. We take this opportunity to thank all the health professionals from all over the world, as they are the main front line in this titanic struggle. Finally, we reiterate our commitment to continue to make coordinated efforts to overcome current constraints and call for the need to strengthen the implementation of the global strategy on public health action plan and innovation, attributing greater investment in research and development, which can contribute to discovery of drugs and vaccines against COVID-19, and thus to improve the health situation of our communities. I thank you for the attention.
Thank you, Your Excellency. I would like to read out the 10 following countries on our speakers list. It will be starting with Qatar and then following with Luxembourg, Barbados, Niger, Paraguay, Portugal, Armenia, Mali, Iceland, Lithuania, and Latvia. Qatar, distinguished minister, you have the floor.
Your Excellency, Madam President, Your Excellency, WHO Director, Your Excellency, ladies and gentlemen, Qatar has addressed the COVID-19 threat to the whole government, whole society approach. Continuity plans were put into action to ensure that our everyday activities, the businesses and society at large function as normally as possible during this pandemic. In order to control the spread of the disease in the community, we activated extensive community surveillance systems to detect clusters and respond promptly with control measures. We are still in the exponential growth phase of the pandemic, and we are reaching our peak. The number of cases reported is high, 11,600 per million, but as documented throughout the world, this is in great part due to our intense testing policy and case finding, which allows us to detect a larger fraction of positive individuals than usual. Currently, 94% of our positive cases are mild or asymptomatic, 5%
Your Excellency, we have some technical problems. We lost you. Can you start again, please?
Sure. Is it clear now?
Yes, please. Go ahead.
Would you like me to start from the beginning?
Yes, you can.
Okay. Your Excellency, Madam President, Your Excellency, WHO Director General, Your Excellencies, ladies and gentlemen, Qatar has addressed the COVID-19 threat with a whole government, whole society approach. Continuity plans were put into action to ensure that our everyday activities, the businesses and society at large, function as normally as possible during this pandemic. In order to control the spread of the disease in the community, we activated extensive community surveillance systems to detect clusters and respond promptly with control measures. We are still in the exponential growth phase of the epidemic as we are reaching our peak. The number of cases reported is high, 11,600 per million, but as documented throughout the world, this is in great part due to our intensive testing policy and case finding, which allows us to detect a larger fraction of positive individuals than usual. Currently, 94% of our positive cases are mild or asymptomatic. 5% require hospitalization, and only less than 1% end up in the ICU. We have seen very few deaths among patients with COVID-19. Our case fatality rate is currently 0.5 per thousand. We believe that this picture, different from that of a number of other countries, is attributable to several factors. The overall young age of our population, the active search for cases through an intense testing program. We have tested approximately 56,000 persons per million and a very efficient and effective healthcare system which diagnoses and treats the most severe patients early enough to improve their course of disease and decrease complications. To prepare our healthcare system to respond to the challenges posed by the epidemic, we activated our contingency plan to increase our capacity in infrastructure, manpower, and resources to deal with any anticipated surge required as a result of increase in demand. We intensified our relevant training programs and ensured that our staff have the necessary PPE for their safety. And to ensure that all our patients are taken care of and not overlooked while we are fighting COVID-19, we transformed our healthcare services, primary elective care, and particularly for those with chronic diseases, are assisted virtually to ensure that this vulnerable group of population have continuity of care. Your Excellencies, ladies and gentlemen, our Emir, His Highness Sheikh Tamim bin Hamad Al Thani, recognizing our responsibility towards the global community, has directed that respective authorities, Qatar-based institutions, should provide all possible global support to the people and countries impacted by the COVID-19 pandemic. As a result, Qatar Airways has carried around 1 million global citizens back to their home countries, as well as repatriated thousands of travelers stranded by coronavirus aviation shutdown through chartered flights. Qatar Fund for Development has also provided around 132.5 tons of medical aid to 13 countries so far. In this regard, we believe that universal, timely, and equitable access to and fair distribution of all quality, safe, and efficient and affordable essential health technologies and products should be ensured in line with the Doha Declaration on the TRIPS Agreement and Public Health. The state of Qatar has also recently co-launched alongside South Korea, Canada, and Denmark, and Sierra Leone in a virtual event at the United Nations headquarters in New York, the Group of Friends of Solidarity for Global Health Security to combat the coronavirus pandemic COVID-19. We call on all countries to join us in this initiative, and we thank WHO. Thank you, Your
Thank you, Madam Minister. We go to Luxembourg now. Your Excellency, you have the floor.
President.
Thank you, Chairman. Chairman, Director General, Your Excellencies, ladies and gentlemen, Luxembourg aligns with the statement made by the European Union and its 27 member states. We deplore the tragic losses in human life and the suffering being undergone by countries around the world as a result of this unprecedented health crisis. We express the strongest possible support for multilateralism, the role played by and leadership shown by the WHO in its response to this pandemic. And we'd also like to thank the Director General and his team and the entire WHO staff for their tireless efforts to contain this pandemic. We must put on record our recognition for the fundamental role played by healthcare workers in this crisis. They have paid a very high price in their daily mission to save lives. We would also emphasize the need for safe and effective development of a vaccine against COVID-19. When we get one, it must be fairly accessible to everyone and available at a reasonable cost, because it will be a shared global good. We emphasize the need for an approach based on human rights, leaving no one behind, and underscore the urgent need to protect health and maternal, sexual and reproductive rights. As a reliable and flexible partner of WHO, we feel the need to increase our obligatory and voluntary contribution to the organization and to its member states so as to turn around its situation of chronic underfinancing. We would also like to see more transparency in sharing information as part of our overall response to the crisis. Our priority is and must remain the testing of all individuals to ensure proper tracing and identification of anyone carrying the virus. Such people must be quarantined once tested positive, as must their close contacts, and this, together with barrier measures and social distancing, will help us to contain the pandemic. Last but not least, we support an independent evaluation of the crisis management once the crisis is over. International cooperation, solidarity and joint action are more essential now than they've ever been as we tackle this pandemic. We trust that we will overcome this crisis if we work closely together. Thank you.
Merci, Monsieur le Ministre.
Thank you, Minister.
The Minister from Barbados, you have the floor.
Honorable delegates, Barbados has set out on the journey to strengthen its health systems in the face of and in response to the relentless COVID-19 pandemic. Within a few short weeks of the first cases being reported in China, we immediately set up our Health Emergency Operations Center to guide the implementation of a suite of strategies aimed at preventing or delaying, detecting, suppressing, and containing the transmission of COVID-19 in Barbados. Key highlights of our response have included procuring urgently needed medical equipment and supplies in an environment of global scarcity, strengthening the infrastructure of the healthcare system, including laboratory capacity for the diagnosis of COVID-19. We are cognizant of the ongoing health needs of our people and are determined to not be paralyzed by this pandemic. We must continue to adequately address all the pressing health concerns, ranging from NCDs to maternal child health issues and to disaster preparedness, to mention a few. Barbados will continue to work on understanding the social, economic, and political impacts of the current crisis and to craft strategies to mitigate them with sustainable, resilient, and rights-based solutions involving an array of actors with a whole of society approach. However, implementing comprehensive health strategies aimed at suppressing transmissions and preventing them from spreading, along with focused efforts on linkages between health systems and health security, requires sustainable resources. Despite our country's designation as a high-income country, we and other similarly vulnerable states urgently need global support and solidarity to ensure the continuity of essential health and social services to safeguard the health and well-being of our people. We remain appreciative of the efforts of WHO, PAHO, and the Caribbean Public Health Agency, CARPA, in providing unwavering assistance and stewardship to Barbados and our partner countries in the Caribbean region as we aim to improve the health and quality of life of all of our people. I thank you, Madam President.
Thank you, Honorable Minister. I would like to invite Niger to take the floor, followed by Portugal.
Madam President,
President, Director General, distinguished delegates, ladies and gentlemen, may I first of all convey to you the warmest greetings and congratulations of the President and the other staff members of the President's office. We'd also like to congratulate you on your elections. And I'd like to conclude these preliminary words by congratulating Dr. Tedros Ghebreyesus and the WHO staff for organizing this session in particularly difficult circumstances. We're grateful for their dedication to carrying out their mission despite the circumstances. Since December 2019, the entire world has been facing the coronavirus pandemic. The health crisis it has brought in its wake has had massive social and economic consequences and, of course, health consequences, and we haven't yet managed to get a full picture of how large they will really be. We registered our first case on the 19th of March, and since then 876 cases were notified, with unfortunately 50 deaths. We drew up an early preparation and response plan, which was financed by the state and its technical and financial backers. We need to be vigilant in tackling the impact of the infections and managing them. This crisis has hit us in a context where our health systems were already weak and where we also face major security problems in the Sahel region. We urge that the international community assist us financially and in other ways so that we can better tackle the effects of the pandemic and indeed the effects of other emerging diseases in our countries so that our health system can cope. I would like, in conclusion, to thank WHO and other bilateral and multilateral partners that we have for the multifaceted assistance they have given us to prevent and manage the pandemic. That helped us come at the time when we need it most. We welcome the ACT initiative taken by WHO and her partners to work on the development, production and equitable distribution of vaccines, diagnostic kits and drugs to treat COVID-19. We urge the international community to mobilize around WHO and support it so that this initiative can be brought on stream as quickly as possible and fully supported. Thank you. Thank you, Minister. I now give the floor to the delegation of Portugal. Your Excellency, the floor is yours.
Director General, dear colleagues and delegates, when we met a year ago in Geneva, it would have been difficult to imagine that the next World Health Assembly would take place in these circumstances. The COVID-19 pandemic changed our lives, and its impact and consequence will continue to be made felt for quite some time. It reminded us of the importance and central nature of public health and how important and transversal its implications are on society. It also showed us that no country is completely prepared to face such a threat and how we need and depend on one another. Before underlying a few of the main lessons of the pandemic, I'd like to give some thanks. First of all the healthcare professionals and the other healthcare and other professionals who were at the front line. Then I'd like to thank society in general, and please allow me to particularly thank the people of Portugal for their responsible manner in responding to lockdown and other rules for the slow retaking of societies and normal life. The United Nations has taken its role very seriously, and in particular I'd like to highlight the role of the WHO. And finally, I'd like to thank the scientific community for their efforts and mobilization for research and development of treatments and vaccine. The fight against COVID was a priority for the government of Portugal, and as part of this, human rights were very important during the state of emergency. We made regularization of temporary regularization for the status of all migrants, refugees and asylum seekers, ensuring that they had the same services as Portuguese residents so that they could have access without discrimination to health and social services. We also ensured that we worked on having social support for workers and the most vulnerable societies. And it's also something I'd like to finish with, that it's important that we invest in strengthening healthcare systems and universal health coverage. And this will take place through a strong public health architecture on a global level, which is coordinated and shows solidarity and transparency. Thank you.
Thank you, Madam Minister. Now I'd like to invite Armenia. Your Excellency, you have the floor.
Honorable President, Director General, Ministers, Excellencies, distinguished delegates. We thank the WHO for convening World Health Assembly at this critical time. COVID-19 pandemic is spreading worldwide. This session is not only the first visual meeting of WHA, but also the most important one to understand where we are and discuss further way forward in implementing our joint approach to response to COVID-19 nationally and globally. It is my honor to represent the Republic of Armenia by the delegates to fight against COVID-19. Every single day of past months, every single hour, we engaged ourselves in a battle wrapped in uncertainties. The path of our response to the side may seem like a walking in the dark. But the good news is that the strategies of early detection, isolation, testing, contact tracing, and quarantine, coupled with physical distancing, have shown to be critical elements to slow the disease transmission. Dear colleagues, the COVID-19 pandemic pushed many of us into new realities. But one thing is clear for now. Priorities have not been changed, and became bolder. Let me summarize 4 lessons learned. First, the COVID-19 outbreak revealed gaps in our systems, but also showed our strengths developed from the valuable experience responding to other health threats. The epidemic proved that health is one of the most important priorities of all governments. Second, emergency preparedness is a core for effective response and containment of the epidemic. Armenia has the wealth of experience in implementing agile emergency capacities, but we should certainly revise the approach to implementation of unified measures and communication. Third, beating NCD is also at the core of COVID-19 response. Epidemic hits the most vulnerable with NCDs. Therefore, we should continue focusing on prevention, early detection, and management of NCDs to prevent the onset of disease, neither struggling to save their lives during any epidemic. Fourth, as COVID-19 continues to spread around the world, ultimately, the fight with the pandemic requires new tools, more research, and innovation at global level. Pandemics of this magnitude do not respect borders. Therefore, they require global action to counter and overcome the crisis. Indeed, the national community, regional cooperation, and global solidarity are essential to these efforts. I thank you for your attention.
Thank you, distinguished minister. Would like to invite Iceland to take the floor. Your Excellency, please go ahead. You have the floor.
President, Director General Dr. Tedros, honorable ministers, distinguished delegates. Iceland would like to thank WHO for its guidance and leadership in combating COVID-19. The pandemic concerns us all. A global platform like WHO is important when fighting a common threat. In Iceland, we have followed WHO guidelines and leadership. We have been able to delay and prevent the spread of the virus, safeguard our healthcare system, and protect our population. The Icelandic healthcare system has endured the pressure of the pandemic. We have managed to build a strong and resilient public health system that is both flexible and adaptive. The lessons we have learned will be useful when planning for the future. The outbreak is causing unprecedented crisis with increased unemployment and insecurity affecting people all around the world. We need to monitor the impact on people's mental health and well-being, protect our social infrastructure, and ensure that no one is left behind. Attention must be made to vulnerable groups like women and children, as well as the populations of the developing countries. We are still in the middle of the pandemic. Continued global solidarity is essential. This includes collaboration in research and in the development of a vaccine against the virus. We live in a community of nations where we share common goals, which we recognize as the UN Sustainable Development Goals. Let's make these goals guide us on our way forward, building on the principle of leaving no one behind.
Thank you, Your Excellency. Would like to invite Lithuania. Your Excellency, you have the floor.
Honorable Chair, distinguished Director General, colleagues. Lithuania fully aligns itself with the statement made by Croatia on behalf of EU and its member states. Today, the world is facing the unprecedented challenge posed by COVID-19 pandemics, the challenge we have never faced before in our lifetime. The pandemics has a significant impact on the health systems, economies, livelihood and well-being of the societies and adversely affects the exercise of human rights all over the world. We cannot win this war standing alone. Only by adhering to the principle of effective multilateralism, only by working together, we are stronger and more effective. Only solidarity and unity will help to effectively respond to this fast-growing threat. We emphasize the need for the global leadership in coordinating joint international efforts and actions. Therefore, we recognize and appreciate the leadership and efforts of the World Health Organization in supporting and guiding member states as they fight the pandemics. We also recognize the importance of research and development, including the development of vaccines and their accessibility and affordability, diagnostics and treatment, as well as the availability of personal protective equipment equitably to all population groups. Lithuania reacted very rapidly to the extent of the spread of the virus in the world and the threats posed by it to human health and life, and has taken effective measures to contain the virus from spreading. Lithuania remains committed to working together with the international community in responding effectively to COVID-19 crisis. Thank you.
Thank you, distinguished minister. We would now like to invite Latvia to take the floor. Your Excellency, you have the floor.
Distinguished Director General, Excellencies, ladies and gentlemen, Latvia aligns with the statement of the European Union. Currently, due to COVID-19, the whole world is undergoing a challenging time that tests not only the national health system's capacities, but also society's physical and mental health. The virus has affected all possible sectors, but there is no time to mourn the losses and adversity associated with COVID-19. This is time toward finding solutions to the current challenges, to evaluate response actions, draw conclusions on which measures work better than others, and to move forward with renewed vigor into the future. Latvia is one of those countries where the response to COVID-19 was very well managed. It is due to the hard work of our epidemiologists who studied each case very thoroughly, tracing the cases and contacts. We have applied the whole government approach following closely the epidemiologists' advice. We have dedicated health workers. Population has followed sanitary guidelines. It has been a common effort. The first lesson that we learned was that the evidence-based approach is the best. Latvia highly evaluates the contribution, support and guidelines of the World Health Organization and its coordinated approach not only in the initial stage of COVID-19, but also now in the transition phase. Latvian government also supported the work of WHO by a voluntary contribution to the Strategic Preparedness and Response Plan. Undeniably, COVID-19 is a painful experience for the whole world. It has shown the need for coordination and international cooperation transcending national boundaries. Latvia believes that only together and united in solidarity we can overcome challenges and prevent future pandemics. Thank you.
Thank you, Madam Minister. We would like to invite Kazakhstan. Your Excellency, you have the floor.
President, Director General, on the behalf of the Ministry, it is my great pleasure to address you at the 73rd session of the World Health Assembly. I would like to express our gratitude and full support to the World Health Organization and its Director General, Dr. Tedros, for leading role in the combating of COVID-19. We thank WHO for all technical guidance in the preparedness, readiness, and response action to COVID-19. Kazakhstan has taken tremendous effort to contain the spread of COVID-19, and now we are focusing on transition by mitigating restriction measures. At the same time, we are taking actions to robust the health system for the possible wave by integrating primary health care into the overall public health response to COVID-19. The role of PHT is crucial in informing patients and community about the COVID-19, interrupting the chain of transmission and identifying vulnerable populations, as well as ensuring appropriate referral for home isolation and hospital admission. The other important issue is a broader use of digital technologies and development of a digital health ecosystem, which provide us new possibilities during the challenging time for the COVID-19 pandemic. Digitalization of public health surveillance, laboratories, and PHT has been playing an important role in Kazakhstan in timely and right action. On the last session of WHO Executive Board, Kazakhstan initiated the decision on primary healthcare to adopt the operational framework on the PHT that was supported by all member states. I once again want to highlight the importance of strengthening primary healthcare, which is playing a major role in the eradication of current pandemic and prevention of other infectious diseases. We need to stay on track of the principles of UHC and PHT. Dear colleagues, the whole world, international organization, and other stakeholders need to combine efforts to provide people with safe, effective, and affordable vaccines, tests, and treatment. We express our highest appreciation and support to the dedication, effort, and sacrifices of all healthcare professionals, health workers, and other relevant frontline workers. Only together we can win. Thank you.
Thank you. We would like to invite Morocco. Your Excellency, you have the floor.
بسم الله الرحمن الرحيم والصلاة والسلام على أشرف المرسلين أصحاب الفخامة.
In the name of God, the Merciful, ladies and gentlemen, WHO Director General, distinguished ministers, a very good evening. The COVID-19 pandemic is a major challenge for us all, and it's unprecedented since the Second World War. It has a major social, economic, and political impacts, and as a result, we need to take action in order to contain the pandemic. Therefore, we need to see the WHO playing an essential role, and WHO, through its Director General, is playing that leadership role. We are facing this COVID-19 pandemic, and Morocco is doing its bit to take measures to try to contain the pandemic. And we have made the health of our people our primary focus. We've been focusing on creating the conditions for social peace and trying to support the economy as well. So we are all working together to try and manage this as well as we can. We have imposed measures regarding quarantines, regarding social distancing, the closure of public spaces as well. And we have strengthened our infrastructure, in particular in the healthcare system. We've stepped up the health capacity. Quite apart from the preventive measures that we've been taking to protect women and other vulnerable groups in the population. We are also focusing on trying to ensure the accessibility of protective equipment and other medical products. Ladies and gentlemen, the international community needs to share its experience and knowledge regarding essential medical products. That's the only way in which we are going to overcome this pandemic. Thank you very much for your attention.
Merci, Monsieur le Ministre.
Thank you very much, Minister. Romania, Your Excellency, you have the floor.
Honorable Chair, Director General, Excellencies, Honorable Ministers, Romania fully aligns itself with the European Union statement. The COVID-19 pandemic brought us together today in a virtual format. The same exceptional circumstances have called upon us to come together to show resolve, commitment and solidarity. The coronavirus knows no boundaries, no social status, religious belief or political preference. I would like to express my deepest sympathy to all the families of the victims of this unequal battle, with a special thought for all those on the forefront of the fight against COVID-19. I'm confident that we will emerge stronger from this dramatic crisis, but to do so, we need a coordinated and human rights-based approach. I would like to thank World Health Organization for the constant and qualified support to member states, demonstrating leadership as coordinating authority in this time of crisis. Romania's national containment strategy has used a comprehensive approach of identifying, testing, tracing, isolating and treating infected persons. Romania, as most states, faced difficult decisions in responding to the pandemic. Lockdowns, closure of schools, restrictions on services, physical distancing, border closures with a significant socio-economic impact. Our citizens deserve our appreciation for respecting rules and coming together in this very difficult time. This crisis can and should be an opportunity to build a more resilient world by thinking and acting at a global, regional and national level. We need to partner in order to develop and to ensure equitable access to safe and effective medicines and vaccines against COVID-19. Thank you.
Thank you, Honourable Minister. I would now like to invite Ireland. Your Excellency, you have the floor.
Yes, thank you. Honourable Chair, distinguished Director General, distinguished delegates, Ireland aligns itself with the statement delivered by Croatia on behalf of the EU and its member states. In the COVID-19 pandemic, we are facing global challenges unlike anything seen before in our lifetime. I wish to pay tribute to all healthcare workers serving on the front line, in particular, those who are doing so in humanitarian settings. They are showing extraordinary courage and dedication in their efforts to respond to this virus, and we call for their protection to ensure them around the world. In the International Day of Nurse and Midwife, we also recognize the special contribution of our nurses and midwives, who account for half of the world's health workforce and are playing a critical role in our response to COVID-19. Ireland strongly supports WHO, believes that the UN is the most central for a global response across the three pillars of development, human rights, and peace and security. Should Ireland to the Security Council for the 2021-2022 term, we will work for the leadership and engagement expected of the Security Council at this critical moment. As we work towards effective treatment and a vaccine, we must ensure that there is equitable access to vaccines, diagnostics, therapeutics and equipment in line with our commitment to the 2030 agenda to leave no one behind. Ireland will continue to act in solidarity to help around the world and has already allocated more than 78 million euro to the global COVID-19 response, including a fourfold increase in our WHO contribution this year. I am also conscious of the importance of maintaining the range of essential health services at this time, including immunization, victims, and also the priority of strengthening resilience in our health systems to build back better. Ireland stands ready to work with the international community to put an end to this crisis as soon as possible. As we say in Ireland, "Niart Gacurla Celia," or there is strength when we come together. Thank you, Chair.
Thank you, Madam Minister. Would now like to invite Pakistan. Your Excellency, you have the floor. We have some technical problems. Pakistan, we will continue to Cambodia. Your Excellency, you have the floor. Your Excellency, we can hear you. Please continue.
Pakistan. Honorable Presidents, Honorable Dr. Tadros, Honorable Ministers, distinguished ladies and gentlemen, today I'm truly delighted and extremely honored to have been invited to address this 23rd World Health Assembly on the topic combating COVID-19. On behalf of the Royal Government of Cambodia and my own behalf, I would like to express my deep appreciation for the invitation extended by His Excellency Dr. Tedros, Director General for the World Health Organization. COVID-19 shows Cambodia is a small country with a big heart. Cambodia has been calling for global and regional solidarity. No one can overcome the COVID-19. Cambodia has been recognized globally for the management of the Western cruise ship Haven in February 2020. The decision made by Sajika Mahasana Johnson, the Prime Minister of Cambodia, chose to accept the ship to dock in Cambodia that was running short on supply to being turned away from several parts of the world. In collaboration and coordination with the World Organization, USCDC, and Institute Pasteur Board, and other partners, Cambodia made great effort in managing the screening, quarantine, blood testing, onward transfer of passengers and crew members. Cambodia and managing the Western cruise ship event have highly appreciated positions at work. At the time, the common health by COVID-19 required life, solidarity, and vital cooperation more than ever. I believe that the World Health Organization and UN special agencies should handle the question related to Taiwan and according to the One China principle set for Resolution 2758 of the UN General Assembly, the Resolution 25.1 of the World Health Assembly. Cambodia respects the decision of the Republic of China to set up measures. Since the first case detected On 27 January, Cambodia made our heavy effort to rapidly respond to all 100 confirmed cases with no death and 102 recovered today. We did not have any new cases for more than 1 month. However, in our high vigilance, we are currently adjusting our public health and social measures through wise approach to maintain social economic continuities. Cambodia's development master plan 19 with 9 priorities area. 1. Incident management and planning. 2. Surveillance and risk assessment. 3. Laboratory. 4. Clinical management and healthcare services. 5. Infection prevention and control. 6. Non-pharmaceutical health material. 7. Risk education. 8. Point of entry. 9. Operational logistics. Your Honorable Minister, National Committee to Combat COVID-19 has established and led some major cameras and operations. The Prime Minister of Cambodia, then the entire National Committee to Combat COVID-19, lead Prime Minister has played a role and leading and coordinating the presentation and playing each role and responding. Leading, coordinating them implementation measures across the whole of government and whole of society, including screening, quarantine, contact tracing, pharmaceutical and reducing risk and their own setback, as well as supporting communication and messaging. Measure for communities addressing the social and economic impact and ensuring business continuity with strongly support by the provincial committees to combat COVID-19 at the subnational level. Good progress has been made and the implementation of the master plan funding has been mobilized the Royal Cambodia Development private sectors and civil society, national hotline investment team, capacity, testing enhanced, value physical distancing measures like school closure, school closure, and other technologies to reduce transmission. Health facilities and upgrade to manage COVID-19 patients with health workers
Excuse me.
case management and infection prevention.
Excuse me, I would like to interject here. My apologies, but the distinguished delegate has far exceeded the allotted time. He needs to wrap up, please.
And many countries now have been supporting Cambodia in fighting against COVID-19 today. Finally, I wish you as head of the delegation, delegate, ladies and gentlemen, good health and success in the deliberations.
Thank you, Honourable Minister. Would like to invite New Zealand. Your Excellency, you have the floor.
This crisis has reinforced the critical importance of healthcare and other essential workers, as well as global cooperation. New Zealand has looked to the information and experience of others to help shape a response appropriate for our own national context. We've also been open to sharing our experience in the hope that it will benefit others. Our relationship with the Pacific is particularly important in this respect. In looking to the future, we will be able to save lives, communities, and economies if we commit to building on the strengthening of global relationships and mechanisms. In this respect, New Zealand is pleased to co-sponsor the resolution on COVID-19. We very much hope that all member states join with us in taking the steps towards a new era of global solidarity. It is vital that we uphold principles of non-politicisation and inclusivity when we come together at the international level. There is much work ahead, and New Zealand stands ready to work alongside the WHO, other member states and organisations. This experience has reinforced the critical role of the WHO, and we have borne witness to the excellent support provided to our neighbours in the Pacific, as well as using WHO's technical products nationally. In New Zealand, we will continue our focus on protecting the most vulnerable in society. As part of this, we recognise that people will experience differences in health and well-being that are not only avoidable, but that are also unfair and unjust. In the context of COVID-19, addressing equity means protecting older people and those with underlying conditions. It also means actively focusing on and mitigating any risk that this situation will further exacerbate the inequalities experienced by Māori and Pacific peoples in New Zealand.
Thank you, Honourable Minister. I would like to invite Cyprus. Your Excellency, you have the floor.
Of the world, on behalf of the Republic of Cyprus, a small island of 900,000 citizens in the Eastern Mediterranean, a member of the EU, it is my pleasure to address you today on the 73rd World Health Assembly and to express our gratitude to the World Health Organization for showing its global leadership in these unprecedented times. Cyprus aligns itself with the EU statement delivered by Croatia on behalf of the EU and its member states. Furthermore, we are grateful for the leadership role of the Director General of the World Health Organization. Today, we are united in a common goal of fighting the invisible, ruthless enemy of the COVID-19 pandemic, limiting its devastating impact on global health, economies, and social order. Today is an opportunity to stand back and take stock of what we have achieved so far, what lessons are there to be learned, and what we need to do in the future to win the war against COVID-19. A gateway between East and West and a popular tourist destination, Cyprus has always enjoyed huge movement of people to and from the island. From the outset of the pandemic, Cyprus has closely followed recommendations from WHO. Since March 9th, when the first 2 imported cases of COVID-19 were identified, as of today, 905 total cases have been reported. 401 of these cases have recovered. 1 in 5 cases out of 5 cases are healthcare professionals, and unfortunately, 17 deaths have occurred due to COVID-19. In the last weeks, the curve is finally flattening, and the number of new cases now is in single digits every day, and the ICU bed capacity is less than 5%. Cyprus has one of the highest uses of diagnostic testing, with more than 8,000 per 100,000 people, and our policy is to test early, contact tracing, and isolate. Our success in dealing so far with this pandemic is based on the following. First of all, there was and still is strong political commitment to take robust and proactive measures in line with WHO guidance to protect citizens from the spread of the COVID-19 pandemic. We did not hesitate to take hard measures early on, always in line with the guidelines of WHO and ECDC. As of February, we took measures at our entry points, monitoring passengers according to their country of origin. We implemented social distancing measures and actively educated our health professionals and the public as well. We declared a state of emergency on the 15th of March and allocated €100 million emergency fund for strengthening of our healthcare system. We proceeded with the establishment of public health clinics for assessment and management of suspected cases of COVID-19, an opening of helplines for the public and health professionals. At the same time, we imposed strict lockdown measures that restricted the movement of people, adopting a lockdown stay-home policy with curfews, with penalties for non-adherence and closure of all non-essential businesses. Furthermore, we have restricted entry to the country to only Cypriot nationals who, upon entry, they undergo a PCR test and are quarantined for 14 days in hotels monitored by the government with the assistance of the Ministry of Health. Great emphasis throughout this period was placed in the rapid identification of new cases through early testing and active contact tracing, isolation of suspected or symptomatic cases for 14 days, and self-isolation of contacts, close contacts. Furthermore, we engaged in random sampling and testing of the population, but also the frontline workers and healthcare professionals and vulnerable groups. Further actions were taken to protect vulnerable groups through stay-at-home policies and home deliveries. At the same time, we placed great emphasis on continuous monitoring of personal protective equipment and controlling and procuring stock, equipment and necessary consumables, and last, we actively trained staff in the proper use of personal protective equipment. We took measures to increase the capacity of healthcare system through mobilizing staff, decree of requisition of healthcare professionals,